Disinfection and cleaning of suction systems. The suction system is contaminated to a considerable degree with germs and dental materials, which could lead to the formation of biofilm and a drop in performance or even to the failure of the unit. Therefore, it is necessary to clean and disinfect the suction unit regularly, e.g. with Orotol Plus from Durr Dental for the daily disinfection and MD 555 cleaner for the weekly cleaning. Please wear personal protective equipment and observe the occupational safety directives. We recommend rinsing the suction system with 2 liters of cold water prior to every cleaning or disinfection process. Disinfect the suction handpieces before you connect them to the adapters of the OroCups. The rinsing removes coarse particles from the system. If necessary, the spittoon can be cleaned between patients or prior to cleaning and disinfection measures with MD 550 from Durr Dental. Disinfection of suction systems. The disinfection solution must be dosed according to the manufacturer information. Up to 2 liters of ready-to-use solution can be prepared in the OroCup care system from Durr Dental. We recommend the suction of 1 liter ready-to-use solution per treatment unit. The OroCup is a care system specially developed for suction systems. It creates an ideal air solution mixture which contributes to effective cleaning and disinfection. After the preparation of the solution, 1 liter of the ready-to-use solution per unit is aspirated via the suction hoses. With a filling level of 2 liters, the OroCup must be positioned upright during the suction of the first liter. Thanks to the sophisticated system, the OroCup automatically stops the intake of liquid after 1 liter. With a filling level of 1 liter, the OroCup must be positioned horizontally. The spittoon should be disinfected with at least 250 milliliters solution. The system must not be rinsed with water during the exposure time. The exposure time specified by the manufacturer must be observed to disinfect the suction system and to prevent the formation of biofilm. The disinfection solution Orotol Plus can remain in the system until the next restart of the assembly. We recommend rinsing the system with 2 liters cold water prior to the first patient and following the expiry of the exposure time. Cleaning of suction units. To dissolve acid-soluble deposits such as scale or prophy powder, we recommend using the acidic special cleaner MD 555 cleaner from Durr Dental 1 to 2 times weekly. The cleaning solution must be dosed according to the manufacturer information. The cleaning should be preferably carried out during the lunch break. Thus, the necessary time interval to alkaline reacting disinfection with Orotol Plus is guaranteed and a mutual neutralization of the products is prevented. After the preparation of the solution, 1 liter of the ready-to-use solution per unit is aspirated via the suction hoses. The spittoon must then be cleaned with at least 250 milliliters solution. It is essential to adhere to the exposure times defined by the manufacturer in order to successfully clean the suction system. The system must not be rinsed with water during the exposure time. Please note, we recommend rinsing the suction system with 2 liters cold water prior to the cleaning or disinfection. A time interval of at least 2 hours must be observed in order to prevent a mutual neutralization of the alkaline reacting disinfection with Orotol Plus and the acidic cleaning with MD 555 cleaner. Please observe the exposure times at all times.